Hello everybody. Today I have the honor and pleasure of welcoming with me on this DAMS studio Dr. Shivangi Mangal. She has secured rank 85 in AIIMS November 2019 exam conducted recently. Congratulations Shivangi.
Thank you sir, thank you very much.
And welcome to the DAMS. So how are you feeling now, first of all?
Sir, I'm feeling absolutely great. More than me, I think my parents are feeling much happier for me because I don't think that I would have expected a rank in first attempt. I was just giving for the sake of giving the exam, but I got this rank, so I'm really happy right now.
Yeah, as you mentioned, the first attempt, many interns are looking here towards your video and they are saying that is it possible to clear the AIIMS exam in the first attempt with internship going on?
I think it's pretty much possible that you can clear AIIMS exam first attempt. Actually, many of the people who get good ranks are only the first attempters, as far as I have seen. As my seniors and other colleges in Delhi, I've seen that many of the toppers are actually the first attempters only, because in AIIMS exam they ask very general things which you are just going through in your internship or you just done in final year or third year. So I think it's better to go for it in first attempt rather than dropping a year and then trying hard.
Very good. So how was this AIIMS exam in general, November 19 exam? In general, how was your opinion about the paper?
Sir, I think it was a balanced exam. The questions were actually good. When we were, I think that when I was attempting the exam, I did not feel pressure that I had to memorize something or I had to recall something that where is this coming from. I think it was based on general things that you see in your OPDs, wards, postings, what you've done in there. If you've attended emergencies, and what would you do if you were in that scenario. I think those were the questions that came more. And I think it was just based on common sense, that what would you do to that patient. The questions were generally from there. So I think if you've learned the concepts in your MBBS thoroughly, then I think that any basic person who has just learned the concepts can actually do the exam very well.
Very good. This was general opinion. Anything about the new pattern of questions being asked in the AIIMS recently?
Sir, I think new pattern, since I've never attended the previous pattern, so I think this pattern is actually good for me, because I think it tries to eliminate those students who just mark, they sometimes try to mark one option, they try to guess one. So they have tried to eliminate those students who just try to do guesswork. So you have to be sure when you're marking those questions, because the negative marking is also high. So I think that really gives you a heart attack at that point, that do you need to mark it or not. So many of the questions are actually left because in those questions, and it takes a lot of time also. So it is just not 200 questions, it is 288 now. So I think it took me a lot of time to understand that I have to attend those, not just 50 questions, but those are actually 138 questions that I have to attend. So I think they've made it a little more difficult, but just like that, I think the if you're preparing well, then you can do them as well. It's nothing new, it's just the concept has changed, but I think the syllabus and from where they are covering the topics are the same.
Out of the new pattern, which type of questions you were most comfortable with and most uncomfortable with?
Sir, I think new pattern in which there was this extended marking question,
yes,
in which they give a whole clinical history and then they ask you to make a diagnosis. I think that it takes a lot of time, maybe, but I think it's very easy to reach to a diagnosis in that. So I think that it's better to attempt those questions because you're sure that this will be the answer. In otherwise, true and false, you might be wrong, you might be, correct. So I think the best was, for me, it is extended type matching. And other than that, I guess match the following is also good, because you either know it or you don't know it. You can just, mark it very easily. So I think true and false is a bit tricky for me. And these extended matching and match the following is the best for me.
Okay, so how did you manage time during AIIMS exam? Could you finish the paper?
No, sir, I was actually not able to finish the paper. I really underestimated those 50 questions, the new questions, because I thought that, okay, I'll do it, fast. But I wasn't able to complete. I actually left 10 questions. And on the paper, it showed me that I've just attempted 233 or 36. So I was quite disheartened that at least I could have completed the paper, but I wasn't able to. but I think maybe the question that I mark, maybe the accuracy might have been good.
And in single answer response questions, how was the quality of the question or the standard of the?
Sir, in single answer, there were a mixture of questions. I just left, I guess, 5 or 6 questions in the 150 questions that were there, because, and I did not keep anything for mark for review, because I knew that I won't be able to come back to those questions. So I better just give my answer then and there only. And sir, the questions quality was average. It was not too difficult. Yes, there were some questions that I had not expected, like in anatomy there were more of cadaveric images, which I personally never tried to look back when I was reading anatomy. But otherwise there were more general basic questions and the conceptual questions which you see or you hear from your teachers. Those were the questions.
And any particular subject asked more or less in AIIMS?
Sir, I think the short subjects are asked less, 5 or 6 questions. And sir, the medicine and surgery, I think the number of questions that they deserve, were the number of questions that we had in our paper. Pharma was around, I guess, 19-20 questions. Ops was also around 18-20 questions. So I think it was a good share of questions divided in the subjects.
Okay. Have you seen previous AIIMS papers any while preparing for this AIIMS?
Yes, sir.
As compared to previous AIIMS, how will you rate this AIIMS paper?
So I think even in, if we see the last year's papers or this AIIMS papers, I saw them, and although in PSN there was no biostats, so I was really shocked that everybody prepares biostats very thoroughly, but there was not even a single question. But the trend was same, I guess, because they were more towards the emergency situations, and even in this paper we were asked a lot of poisonings and how to deal with those poisonings, what kind of poisoning it is, what would you do in the emergency. So I think they're going towards the same trend only, that they want to train us to deal with
emergencies.
Yes,
Okay. So how did you prepare for this particular exam? The students would wish to know.
Yes, sir. Sir, because I was very having a lack of time, having busy postings, so I just thoroughly, and I just tried to stick to one point, that you have to listen to your professors. And in DAMS, they just Sumedh sir only just told that you have to see only last 2 years, maximum 3 years previous papers. So I just stick to that okay, just blindly follow him and follow your teachers. So I looked, and I've seen all the papers, only video solutions I've seen on the eMedicos app. I've seen all the previous 2-3 year papers. And I also watched the emergency medicine videos uploaded on eMedicos app, because
was it helpful?
Sir, extremely helpful. So the videos are so good that even if it doesn't help you in the exam, it just always gives you an idea that how you should deal with the emergency. For your general knowledge also, you must see those videos. And sir, I've seen the capsules and the mop-ups.
Okay.
Yes, sir. And I could not revise them all, but I've seen all the videos. So sir asked us to hit it hard and hit the the high yielding points. So just try to just
focus more on that.
Yes, sir.
So this was your internship year. When did you start your preparation for PG entrance in general?
So I started thinking about trying to go for PG from 3rd year only.
Okay.
And I joined DAMS in 3rd year.
Foundation batch.
Yes, sir.
Yes. So how was your experience with the DAMS foundation batch?
Sir, actually, initially I did not join 3rd year, because I thought that I should prepare it myself. But since all of my friends were actually joining DAMS and they were doing quite well in our college as well, so I thought that no, okay, I have to join DAMS. So I joined it, and it was good. The classes just happened only in Saturday and Sunday, and we used to waste it on doing other things. So it was quite helpful. And since we all are sitting in one classroom, so it's just similar to as college, and it's quite good because you can discuss everything with the professors, any confusion that you might have regarding PG preparation, and at least it comes to your brain that you have to start. So if you're in a college where nobody's doing any preparations, you're like in the cloud that you don't have to prepare. But coming to DAMS, I realized that no, you have to do PG entrance also. So it's better that you start early and you start at this point only.
So in 3rd year you attended foundation batch and you did 3rd and final year subjects.
Yes, sir.
With us. Then in final year you also continued your preparation?
So in final year, I did not join DAMS initially again, but then I joined a few of the subjects. Like I joined physiology because Anupama ma'am was going to take the classes and I did not want to miss them. So I joined, I just took those classes, and I took a little bit of micro and biochemistry also, but I could not continue because of the final year subjects that I had to do.
And in internship, you followed it up with a test and discussion.
Test and discussion, yes.
How was your experience with test and discussion?
Sir, in test and discussion, again, I did not attend all of them, but I tried to give all the tests at home, and then either take notes from my friends or do the TND app that is in my phone always, and I just see the answers in my phone that what have I done wrong. So I tried to at least attend all the TNDs, and in the classroom also I've jotted down all the notes that were given, and I think that in the end I've revised only those.
So, and regarding DVT, did you attend DVT session?
Yes, I've attended DVT. It was a medical fest. I have no words how to describe it, but this is what we actually called it when we came out of it. That is just a medical fest going on. We're studying and we're enjoying as much as possible over here. And so the best part about DVT was that till DVT I thought that I was studying, but I was not really sure how much I know. But when the revision started and I was just engrossed in what is going on, so I realized that okay, I know all these things, I just need to brush upon them maybe in the end, but it's not that I don't know these things. So I was feeling much more confident when I came out of DVT that okay, this much I know. If I want to build up more over this, then I can, but इतना तो जितना बता रहे हैं ना teachers, उतना मुझे आता है.
Good. So it gave you a sense of confidence.
Yes, sir.
Did you attempt CBT also?
Sir, I attended only CBT 3 because first and second I had registered for all the 4 CBTs, but I could not give first and second because of my internship posting. But sir, in CBT 3 I gave, and I found it really difficult because I think that when I attempt a paper, I think that I should mark every question, I should know every answer, but I did not know. So it was bad for me. But when I got the rank, then I realized that maybe okay, it's with everybody.
And grand test, did you attempt it?
Sir, I have not given any grand test, not on the app, because sir, I realized that I should be doing grand test later on, quite later when my when the exams were approaching. So I thought that I should start with the subject-wise test.
That you did?
Yes, sir. I've done all the 18 subject-wise tests.
All 18?
Yes, sir. Sir, but I would just like to mention that I have not given the test, but I've seen the solution videos definitely.
Solution videos. Were
Yes,
they
sir.
helpful? Did you like?
Yes, sir. Definitely, because I think in the span of 2 hours or 1 hour, you can see 200 questions of SWTs, and all of my seniors and even Sumekh Sethi sir's video was there on YouTube that what all you should revise. So it included CTs and SWTs. So I try to make sure at least that I should start and I must complete SWTs.
CT, that is your TND papers,
Yes,
as
sir.
well as SWTs.
Yes, sir.
So were those MCQs helpful?
Yes, sir, definitely. Sir, I'm not sure that how many of them came in the exam, but I think that it
Maybe
makes your
makes
preparation strong. Yes,
Preparation
sir.
strong.
Yes, sir.
Okay. In general, when students ask when should they start preparing for PG entrance, if they would like to know from you?
Sir, I think it is a very personal opinion. People can start anytime, but they should start as early as possible, because if you start early, then you won't feel like you're preparing for PG. You will just give in more hard work in your daily routine. That's it. So it would not feel like you're preparing for PG from beginning. If you like me, I started from 3rd year, but that was just that I started coaching from 3rd year. But if I'm studying in 2nd year, if I'm studying good in 1st year, that is also helping in my PG preparation. So sir, my advice would be just to be academically strong in your college itself. If you're in a prof, then that is the best time to read one subject as thoroughly as possible. You can read it in as depth as possible. You cannot do it in internship, you cannot do it in 1 year drop year maybe, but I think that if you're doing it in your MBBS curriculum only, then it won't add up to your challenge that you have to cover this much. It will be easy for you if you start as early as possible. If you think it as like a PG preparation, then start from 1st year. Yes.
Okay, and in MBBS, when the student is preparing for PG entrance, he should focus more on the theory part or the MCQ part. This is the question students want to know.
Sir, I did not do any MCQs in my 4-year MBBS course. I have completely relied upon my theory, reading on standard books, and that is a must thing. You should always go for your standard books, because in, I think, central institutes, they directly ask you questions from guidelines, and if you are reading a standard book, then you will never be confused by what should be the answer. You will always rely upon that book that you've always read. And even if in internship you have to go back to a book, then you are not scared of that book, you've already read it.
You can refer whenever needed.
Yes, sir.
Okay. And in internship you did MCQs.
Yes, sir.
You started doing MCQs.
Yes.
Okay. Any general advice you would like to give from your side to the students watching you today?
So my general advice would be that that even if you're a very average student, like I am a very average student from the beginning, but if you really want to concentrate and want to crack an exam, you just try to focus. And because MBBS is, I think it is not just for people who think that they are geniuses or can do it very fast, but it's just major hard work and perseverance that you need to put in. And I think it is possible for everybody. If it is possible for me sitting here, then it is possible for everybody. Just to give your heart in your academic years, first, second, third, fourth, prof, and it will be very easy for you in internship year. Even though I haven't still not completed with my revisions, but still you can get a rank like this if you've just studied with your heart in your 4.5 years in internship.
Any person you would like to thank over here?
Sir,
what comes in your mind today?
Yes, sir. Sir, I would like to first and foremost thank my mom and dad, who've always been there for me and supported with me with their whole hearts. I mean, I know everybody's mom and dad says, but I really cannot thank them enough for their efforts for me. And I also want to thank all my teachers in DAMS, who've made amazing videos on the apps, and we've always been teaching. And I think that whatever I know, and when people see me and they think that I know a lot, then I think it's because of what I've learned from here and from all the apps from DAMS, I think. So I really want to thank them.
Okay, last question. Which branch you wish to specialize in? Not yet decided or decided?
Not, sir, I haven't decided yet.
Okay. No. We wish you very, very best of luck for your future. Thank you, Shivangi, for being here. Okay?
Thank you,
so
thank you very much.